Any procedure of the jaws usually involves major restrictions on your diet after the surgery. It can be a simple wisdom tooth removal, or it can be a genioplasty, or it can be a major orthodontic surgery. Whatever the procedure, you usually land up with a big list of do's and don'ts in terms of your diet. So let me today break down on what you can safely have after any kind of oral or maxillofacial procedure. The best option would be any kind of smoothies and shakes. In the initial period, ensure that you always sieve it before you consume it, so that there are no particles which go and get stuck on the suture line or even go inside the wound, which can lead to infection. After your doctor has cleared you of having clear kind of liquids, you can always switch to more pulpy kind of smoothies and vegetable juices. The next option in Indian diet, which is the best when you are switching to semi-solid phase of your recovery period, is all our grains such as sujis and dalias. We usually prefer suji over any kind of dalia because dalia are larger particles, and this again can go and get stuck on suture lines. The same goes for rice. Rice can very easily go and sit on a suture line and lead to infection. So lighter things like suji or powders like sattu powders, ragi malts are preferable substitutes for any kind of grains that you're looking for. The next would be how to include proteins in your diet. Well, proteins can come in the form of your dals, which you can go in for dal soups in the initial period and switch to very mashed form of dal in the later period. If you're non-vegetarian, you can always have lot of meat soups and chicken soups. Sometimes your doctor might also prescribe some protein fortified powders, which if prescribed by the doctor are even safe to have during this period.